Hello, beautiful people. I am Yvette. This is Mind Your Mental Matters. And today I am not alone. Today I am joined by the beautiful, amazing Angelica Mkorongo. She, amongst other things, is the founder and CEO of the Zimbabwe OCD Trust. And she's here to talk to us about OCD. You know, she's going to enlighten us about what OCD is. You know, so many times people are just like, ooh, that one is so OCD, or I'm so OCD, because you just do one or two things and you think you're OCD, right? But now we're going to get to really understand what OCD is. What does it mean if somebody has OCD? The life of a person who has OCD from somebody who has experienced or is experiencing OCD. So, Angelica,
all right.
Welcome.
Thank you. To begin with, those people who say, I'm so OCD, there's nothing like that. Mm-hmm. They don't really know what they're talking about, because having OCD is not about cleaning your hands or washing your hands. It's not about keeping your desk tidy. It's not about having things in an orderly fashion. It's much more than that. It's a real mental condition that you need a lot of energy, a lot of it's actually very confusing if you don't know what you're going through. So obsessive compulsive disorder, I've lived with this disorder for more than, well, it started when I was a teenager.
Before we get started, exactly, I want you to let us know, first of all, who is Angelica? Let's get to know you first.
Oh, yes. Okay. Angelica was born Chiqueta in a village hospital in Mashonaland West, which is about 150 km from Harare. And I was born in a family of Catholics. My parents were Catholic. And I grew up in the village up to for 7 years. I went to school in the village. And then after that, I came to Harare, where I went to a boarding school, a Catholic boarding school. And then from there, went on to do my A-levels. And that's when my nightmare, as I call it, began, when I was in high school. So after high school, I went to Moldova. I don't know if people know of such a country. It's one of those countries. Well, it was part of the Soviet Union then. Mm-hmm. So yeah, so I went to, maybe I should say I went to Soviet Union, but the university I went to is actually now called, is now in a country called Moldova. Mm-hmm. So whilst I was there, again, the symptoms were there and so on. And I don't know how I managed to finish my education and came back home. Mm-hmm. And when I came back home, I got married, and the symptoms were there troubling me, and you can actually tell. Mm-hmm. You can actually tell that there is something wrong with me, that, what I'm feeling is not normal. It's very easy to tell. You can tell, I don't think everyone feels the way I'm feeling. Yeah. Sorry, you wanted to ask something?
At this time, you're having symptoms, but you don't know what these symptoms are. It's like something is happening to you, but you don't know what is happening to you.
I don't know what's happening to me, and I can't talk about it to anyone, because I was really afraid. How do I tell someone all these funny things that I'm feeling and so on? I was afraid that people would just say, this one is crazy. Because I'd never heard of such things.
So now it's you saying that it started when you were in high school. In high school, maybe you're a teenager, right? What's the first thing? What's the first thing that you experienced, that when you think back to it, you're like, this was a symptom. What happened?
What would happen is I was afraid of traveling. I was afraid, every time I say, okay, let's walk into town or let's go somewhere and so on. Depending on what kind of transport I was using, I would actually start, I would have all these flashes of accidents because it looked like I was afraid of accidents. So I'd have also funny flashes of accidents. And if it's a car, we're driving, or a bus or whatever, then I would start having these flashes of the accident, bodies all over the place, body parts and people bleeding and so on. Or if we're walking, I would imagine someone just mugging me or hitting me or, stabbing me or whatever. So every time that would happen, and then I go on these journeys and I come back, nothing has happened. So it was like now a sort of a comfort to say, okay, every time I go somewhere, those flashes have to come because then I know that nothing will happen. I'll be safe. So all those, I remember now saying, but that wasn't normal. It really wasn't normal because why should I be?
Yeah, so it's like you're always imagining the worst case scenario, like
Oh, yes.
comes to everything, you just like, hi, but
Yes. Everything is negative. Everything.
so this happened now from high school, and then you went to university, and then you came back, and now you get married, and you feel like you can't share these things with anyone. But why did you feel like that? Because these are your feelings. So why did you feel like I can't tell anyone any of these things?
It's like they say OCD tells you it's our secret. It's our secret. You don't have to tell anyone about this. You keep it to yourself, then we are safe. You get what I mean?
Yeah.
I started having all sorts of obsessions that were really, where do you want me? College or when I got married?
Let's talk about college, because also again during college you're still a very young person, you know.
Oh, yeah.
You're a young person, you are at a stage in your life where you want to explore, you want to experience lots of things, but it's like there's this thing that keeps on stopping you to say, no, you can't go there, because imagine you go there and then this thing happens, you know. And then also you're alone, you can't really tell anyone. But what I want to know is, at that time when you were in school, did you know that there is a mental disorder called OCD, or you didn't know, you've never heard of it before?
No, I didn't know. I didn't know, and I couldn't again talk to anyone about it. Something that frightened me, and I couldn't share with anyone. How do I share with anyone such
Yeah, like
things?
how do I say this?
And there were lots of foreigners there. And well, there were some Zimbabweans, but again, people, you don't want, I was afraid that what if people start shunning me? What if, you get what I mean? So yes, it was very, very difficult. And what made things worse is that this country was not at that particular time, the conditions at the university were really terrible. The toilets, the bathing facilities, and these people used to spit. They used, they smoke. I think it's like cigars, and then they chew it, and then they spit it out. Oh my God. And for me, that was terrible. That actually just made things worse for me. So much that, I didn't want to go out because now I have to step on that pattern and so on. And going to the toilet was a nightmare because we're sharing toilets and so on. Oh, I think it was horrible. It was horrible. And for people with OCD, as we said, people with OCD like things smart. And anything that is, well, it's not everyone, but some people, yes. But just the fact that things were in that condition, it just made things worse.
I mean, for any regular person who does not have OCD, it would be disgusting. But I guess now also when you have OCD, it's just another level. It takes it to another level, because it's also now affecting you and how you see things and how you do things.
Definitely.
So what now it was the time where you felt like, no, like this can't be normal. I have to do something. What happened?
I think it was more of when I came back Because whilst I was still at college, a number of things happened, but I didn't quite understand, like panic attacks. I remember one day I was a maid of honor at this huge wedding, and I was supposed to give a speech as a maid of honor, and I was supposed to say it in Russian. And of course, I knew how to speak Russian, but someone said, "Okay, say something, say something." And so someone whispered in my ears, "Say something about love." And my heart started pounding, I started sweating, and so on. I couldn't speak. And this guy just put a mic right in my face, and all I could say was about love.
No.
How embarrassing that was. And when something like that happens, then you go home and you start, but what was that?
What happened? Yeah, what happened?
Yes, what was that? And you start thinking about it, you think about it over and over and over, and start thinking, what did I do? What happened? But you don't have answers. You get what I mean? You don't have answers. And one other thing that also happened was, it started actually when I was at college. I saw someone who had his trousers zip open, and I couldn't tell him that your zip is open. And it affected me so much but why didn't I just tell him that your zip is open? And so after that, I started looking at all the men that I came across to see if their zips were closed.
Yeah, exactly.
Oh my God. And I couldn't stop it. No matter how much I tried to stop looking, it just didn't happen.
Yeah, it's like it's an automatic thing now. If you see a man coming, then you have to check if the zip is closed.
Yes, it's like an obsession.
Yeah, because that's
so
the thing also.
Especially when I was caught.
You were caught.
Especially when I was caught, it's like, oh. So when I came back home, especially when I had my daughter, then I started having all these weird thoughts again. I was afraid. It was like I was gripped by fear. Fear of, I don't know. I was afraid that maybe my child would stop breathing. And I was afraid, so I would be checking on her every once in a while. I couldn't sleep because most of the night I would be checking on my daughter. And sometimes I would also have all these weird feelings about, what about if I just suffocate my daughter with a pillow?
No.
What about if I just stab her? So again, all those feelings were actually very traumatic. They were traumatic. I just didn't know how to handle it. And so I was always living in fear. I didn't want to be alone with my child. I was happy when I had to go to work. That meant I spent time away from her and so on. Hello?
Hello. Oh my gosh. No, I can hear you.
Okay. Yes, so that was really, that was traumatic. And I had this thing about my child is going to die, from, I don't know, some disease and so on. I didn't want to breastfeed because I felt that maybe I had a disease and I would poison my child when she breastfeeds. So at 3 months, when I went back to work, I just stopped breastfeeding here, and I gave all sorts of excuses why I wasn't breastfeeding,
Yes.
So all those things, those are horrible things. Those are horrible thoughts. But at that time, I can't remember. I think I just carried on with life. But again, that negativity always, I was always in the negative. I was always thinking of negative things. I'm going to die when, like I was waiting to die, but it wasn't happening. So why am I not dying?
And again, also at this time, you're not sharing these thoughts with anyone. You're not telling your husband, you're not telling your parents, your friends.
No, I couldn't.
Are you thinking that maybe you have postnatal depression or anything like that, or not?
No,
No.
because I'd never heard of postnatal depression.
Mhm.
You know,
Yeah,
this is 19. This was in 1998.
98. Mm-hmm.
98. That's when I gave birth to my daughter.
Mm-hmm. And you
Yeah.
have never heard of depression, postnatal depression, OCD, mental disorders, none of that.
Well, mental disorders, yes,
Mm-hmm.
but it never, it never came into my mind that I could be having depression.
Mm-hmm.
And the effects of depression, and that people do get depression, if you
Mm-hmm.
get what I mean.
Yeah.
Later, not about OCD,
Mm.
OCD was something else. But somewhere along the way, I also noticed that I had a number of family relatives
Mm.
that were acting weird.
Mm.
Particularly these two, there were two that everyone always thought, this one is a little crazy. This one, she's done this, she's done that. And those were like my mother's sisters.
Mm.
So somewhere along the way, I started thinking that, if whenever I used to listen to how they speak, what they would say, and so on, then I realized that no, these people actually have a problem.
Mm.
They have a problem, and some of the things, it was like they were talking like me. It was me talking.
Mm.
You get what I mean?
Mm-hmm.
Especially how they felt about this. They started talking about how, like, one of the artists would talk about how she felt. She was being bewitched she was at a convent. She was a Roman Catholic sister. How she felt that people were going into a room and I don't know, whatever they were doing in there, just being paranoid.
Yes.
Or and forgetting things, quickly forgetting things, like I've put my keys or something in my pocket, and
Mm.
then I completely forget where I've put my stuff.
Mm.
Like that. So the more I interacted with this auntie of mine, the more I realized that no, we've got the same problem.
Mm.
Got the same problem, and she would go to the psychiatrist, and they were always saying, "Oh, they say that she has depression,"
So
and I'm
she was.
like, "Yes, they always say depression, not
Mm.
OCD, not anything else, just depression."
Mm.
And so, but then I also started reading about depression. I started reading about all these other things. And to me, it didn't make sense what she would talk
Mm.
about. And then another auntie again, she left. She was married to someone and she just left her home and went to live on her own. They had it's like they had a small plot somewhere. So she went to live in town and said, my husband is having affairs and the wife wants to kill me. The wife wants to poison me. Oh, yes. So she just left. And this is someone who was a Catholic and brought up by staunch Catholics. And she left the church and went to these apostolic faith healers, these ones that were white and so
Yeah.
on. So she said, no, because they listen to me and they understand me and they're trying to solve my problems.
Mm.
But the problems never went away again.
Yeah.
No, they don't go away because you've gone to an apostolic faith healer.
Yeah.
It's I don't know. I don't know.
Yeah, it's mental
Yeah.
disorder. It's not it's this is the thing that I always say, is that, I mean, we're not saying people should not pray, people should not go to church, people should not depend on God or whatever their belief is in terms of getting healing. But if somebody's diagnosed with cancer, you don't try to pray it away, right?
Oh, yeah.
You go
Yeah.
to a hospital, you go through the chemotherapy, and you pray that the chemo actually works. You
Yeah.
pray that you get a doctor who will understand you, who will diagnose you properly, who will give you the right medication. You pray that the medication works. But when it comes to mental illnesses, it's like, no, we just want to go to somebody who will pray for you, or to go to a specific church, or to go and see a traditional healer, and that alone should be fine. And it's not. It's a combination of things. Keep praying, keep your faith and your belief and whatnot, but do not neglect the medical side of things, because it is a medical condition. And this is what people need to understand.
Yeah, yeah.
So now you
Because
see. Mhm.
no, I was just going to say that during all this time I had problems. I actually went to my church
Mm.
and I kept telling my priest that I'm having these dark thoughts and I've got this dark stuff and so on. And all he said was, okay, I hear you. I absolve you from your sins. Um, yeah, go and sin
Yay!
no more. Say 5 Hail Marys. And the moment I'm walking out of there, the thoughts are back. So,
Gosh, and you're like, what
it
is
is
wrong
not
with
funny, but that's
this
reality.
man? Just prayed for me. The preacher just prayed for me. I'm walking out of church and I'm still having these thoughts. And then,
Oh,
I mean, it
and
makes you feel so bad because you're like, so what kind of person am I?
that's very true. That's very true. I also, I went on the radio and I was speaking on the radio again about OCD, and someone phoned in and said, "Come to our church. You've got demons. Come, we'll
Yeah.
pray for you." And people don't understand that. I've actually been having stressful days the past trying to convince people that OCD is a mental disorder and not a spiritual something. It's not demons, it's not whatnot. They've got all sorts of names for it. And just trying to convince people, it's,
But
oh
where
my
do you
God,
think
it's
it
so
comes from?
draining.
Where do you think
Sorry.
it comes from for especially as Black people to associate any sort of mental disorder with demons, witchcraft, all of the? Where do you think we get that narrative from?
I think, I think anything that we cannot explain,
Yes,
anything that doesn't make sense,
yes.
we just say, no,
It's an easy way
it's
out.
spiritual.
Ah,
Yes, it's an easy way out.
I know
It's an
exactly
easy way
the things
out.
that we don't want to talk about, the things we don't want to deal with, the things we're not trying
Yes,
to understand. It's all witchcraft.
yes, yes.
So now,
And I
yes,
was saying what you were saying, that some people were just thinking you I'm a really bad person. I mean, imagine you've gone to Mapostory, they've prayed for you, you've gone to the pastors, they've prayed, they've removed the demons, you've gone to your priest, and all those things are still there. I mean, you're going to feel terrible,
yeah,
and you feel that, well, I'm doomed. I might
yeah.
as well just end it all.
And that's where a lot of people actually try to end it or actually go ahead and end it all because you've gone
Yes.
through all of these. You've gone to like all the churches that you mentioned, and
Mhm,
still
mhm.
the demons are with you. I mean,
Yeah.
can you imagine what that does to you as a person?
Mhm,
Could I
mhm.
really be that bad? I'm beyond repair, basically.
That's true. That's true. It's better. I'm better off dead.
Yeah, because I
I'm
mean,
better off dead. If
after
I'm thinking about suffocating my child, then I might as well remove myself from this world and let this child live.
yes,
That's our problem. One of our biggest problems. That is, we don't have knowledge. People don't know.
yeah,
People don't want to acknowledge
yeah. People
mental.
don't want to. They don't want to hear it.
Yeah.
Now you see that, okay, I think my aunts and I, we have something in common. I think me and my aunts, we kind of talk the same kind of language. I think
Okay.
they are suffering from something that I'm suffering from, but we haven't
Mm.
given a name to it. This one went to the church and they said this. The other one went to a psychiatrist and they say they wrongly diagnosed her with depression. When do you decide that I want to go now and see a doctor and figure out what is wrong?
I came to a point where I felt that no, I've had it.
Mm,
I've had it. And not only that, I think it was my mother actually.
mm,
She just said to me one day, I think I need to go and see a priest.
mm,
And I said, why? She said, oh, I've been having, ever since I was a teenager, I've been having all these funny thoughts. But then she'd never shown it. Whereas I was saying my other two aunties, you could actually tell that there was something wrong with them. But
mm,
with my mother, I'd never seen it.
mm,
Except for once in a while, I caught her looking quite sad.
mm.
but I thought, wow, I don't know, it was, she also went through a lot in life. So I thought maybe it was why she was sad. But
Yeah.
now when she was started narrating her story to me, I listened, but I didn't say anything because I was now afraid if I tell you that, but what you're telling me is what I'm feeling.
Yeah.
I felt that maybe she was going to feel terrible,
Mm-hmm.
that it might actually affect her more.
Mm-hmm.
So I just did what she wanted done and so on.
Mm-hmm.
But after she passed on, then I said to myself, no, I think let me seek help. And as well, it was like that was the time when the Google thing,
Yeah, it came
when you
out.
could actually, yes, you could actually just Google your symptoms and so on.
Mm,
And I actually took an OCD test,
mm.
their online OCD
Yes,
tests.
yes.
I took so many of those. And my results were 98%,
Wow.
95% that I was OCD and so on. So after I discovered that, what I had actually had a name and it could
Mm-hmm.
be managed, it
Mm-hmm.
took me another year before I could talk to my husband.
Mm-hmm.
Till
Why?
I didn't know how he was going to feel about it
Mm,
because some of the symptoms, like if I'm driving and then I would feel like driving off the road. If I'm, let's say, by the bridge, I want to drive the car off the bridge and just, plunge down there.
mm,
Or sometimes I'd feel like just hitting someone with a pedestrian
mm,
with my car and
mm.
things like that. Those are frightening things. So I
Yeah.
think I was afraid that if I told him, you'd say, no, you can't drive.
And also, you
And
judge yourself first, I think. When you're having those kinds of thoughts, you first judge yourself, and then because
definitely,
of this judgment, you put it on other people and say, this person is also going to judge me. Because
yes.
who thinks like that? Like, why would you think like that? You know?
Mm,
And
mm.
it's this guilt that you carry with you that makes it hard to talk, I think.
Yes, it is. And also not having heard of anyone with such a problem in, no one has ever talked about it.
Yeah.
That is scary.
Yeah.
But after I realized that, I was suffering from OCD, I actually went online
Mm,
and I joined a number of OCD groups. And it's amazing. It was
mm,
like, wow, all these symptoms that I've been having, actually other people suffer from them. And
mm,
people are talking about them. So it was really, it was enlightening.
mm,
So I went to a psychiatrist, someone from my church, who, when he joined the church, he actually talked about mental illness.
mm,
And he simplified it and told people that, no, listen, it can happen to anyone,
mm,
and you should seek help
mm,
when you think you've got a mental condition.
mm.
So I went to him and he was very understanding. There I went and I was crying the whole time I was telling you. And he was so composed. And he looked at me and said, okay, that's normal. And I'm like, what? you know so no, it's one of those. So it was a relief for me after he told me what it was and he put me on medication.
Mm.
I cried almost for a month. I couldn't go to church and not cry, or even just at home. And firstly, I cried because of the relief that, wow, so at least now I know what it is.
Yes.
And just taking the medication made me a completely different person.
Mm,
Just my outlook on life, who I was. I had to relearn.
mm,
I had to find myself again. And
mm.
I also cried because I felt, why did I suffer all these years without getting help? What
Why
was the
didn't
whole
I do it
point?
earlier?
Yes, how come, God, how come you didn't show me? And I prayed and prayed so hard to say, God, what is going on with me? Can you just
Mm,
give me a sign? And, so it was a relief. It was anger. At
mm,
first, initially, I blamed everyone. I blamed the family for not doing anything about it. I
mm,
blamed the church for not being able to help me. I blamed myself. It was all sorts of things. And until I said to myself, no, I just have to accept this. I have to accept this and just find a way of moving on.
To go on.
Yeah.
Did you ever find out from your family why they never got help? Is it because they didn't know, or like did you ever find out?
I tried. I tried talking to a number of family members. The auntie who passed on finally understood because towards the end, she was actually giving people help at the convent. So much that people would phone me and tell me, your aunt is doing
Your
this, your
aunt.
aunt is this. Yes, your auntie, told me off. She's saying I'm stealing, she's saying I'm doing this. So I actually had to go and tell them that, this is it's a family problem.
Yeah, it's a genetic thing.
It's a genetic problem, and she's suffering from it. So you just need to be patient. And she went. She was on medication, but they put her on medication for schizophrenia. And well, you know how it is. There are times when you really can't do much about it, but it sort of helped her calm down, But I knew definitely it was not schizophrenia.
Yeah.
But I said to myself, if the medication is going to help it, let me leave it at that.
Exactly.
Because sometimes trying to tell the psychiatrist what you think and they think that you know too much. Or
yeah, exactly.
Mm-hmm.
What's your experience, or what has been your experience in relationship with psychiatrists? Because again, another reason why people don't like to seek help or go and look for help is because when you watch movies, there is a certain image of what a psychiatrist is, of what a therapist is, of what therapy as a whole is. And it's not always a good one. It's like, no, white people go there and talk about their problems, or why should I go and talk to somebody, a stranger, about my problems and things like this. This is the mentality that some people have based on what they've seen on TV, right? So also for us in our Black community, it's not easy to just go and start to talk about your problems with random people. So what has your experience been like? Going to speak to a psychiatrist. Have you had good ones who actually really care, or they just like diagnose because this is what I've studied, this is what I know? What's your experience been like?
Well, personally, with my psychiatrist, he is good. He is very, very good. And when I say he's very good, it's not just to me, but I've referred other people to him, or some people that I just meet and we talk about psychiatrists. And I hear people complaining about other psychiatrists, and everyone says, go to this doctor, he's good. Go to this doctor, he's good. So I have had a very good, I've got a very good relationship with him. So much that even in certain cases when I'm having issues or panic attacks and whatever, I actually phone him to say I'm having this issue, and then he would just try and walk me through it and so on. But I've taken a number of people to our hospitals, local hospitals, although they do try, but I'm not impressed. I'm not impressed. You find that in most of our psychiatric hospitals, they'll be having students. And to tell you the truth, most of the students don't know about OCD. Yeah. They've heard about it when during the lecture, but they've never really understood what it is all about. So much that my psychiatrist is now the chairperson of the Learning Institutes. He actually suggested that maybe when we are doing topics on OCD, you should come in as a guest, so that at least people can ask questions, so that they can understand exactly how a person with OCD will be feeling and how they behave and so on. Because if we just talk OCD, people don't really understand it. Yeah, people don't understand. And people talk about it like we said in the beginning. They think it's just about cleaning and being extra, but they don't know the obsessions and, that comes with it. So now you have your diagnosis. You said that medication
helped you? How did the medication help you? How do you feel that the medication helped you? Because remember, again, you're having thoughts, right? You're having thoughts, you're having unpleasant thoughts that you want to get out of your mind. So how can medication help to get those thoughts out of your mind?
Well, it's remember that with the OCD, it's an imbalance of the neurotransmitter substance, serotonin.
Yes.
So when I take my medication, it means that it's a supplement. That is, it's sort of trying to balance the chemical. So I find that most of the negative thoughts are gone. Most of the all those images and the voices that I used to hear, they're all gone. And I'm sort of normal. I am normal. Although it doesn't completely disappear. They don't completely disappear, but it's normal. I can, right now, I can't even look at a man's trousers.
Which is progress, you know?
Some of those obsessions are gone. Most of them are gone, actually. And then another thing, remember that OCD can also causes depression. I would, any little thing, and I go to bed, spend days in bed, and so on. But the energy that I now feel because I'm on medication, it's amazing. And I can actually plan and do things. You get what I mean? Okay, today I want to do this, and I go and do it. Whereas before, I'd say, okay, I want to do this, and okay, I want to do this. I can go on for a month thinking about the thing that I want to do, which I never do. You get what I mean? So not only the energy, remember as well that depression, anxiety, they actually cause body pains. That you literally get sick. That's why maybe, again, the thought of dying was always there, because I'd have headaches, backaches, body pains, chests, and you name it. So much that all those things will just make you feel like, oh, you've got this horrible disease and you're going to die. So all those are gone. So when I'm sick, it's actually because of something else. Not because I'm depressed because of OCD. So all those were actually life-changing. Those were life-changing.
All right. So now you have your medication that you take on a daily basis, and then you also go for therapy every now and then. Yeah?
I used to go these days I'm going like twice a year.
Okay. That's great.
I mean,
hello. That's really nice.
The other thing that has actually helped me, and as I said, is talking to people like you. It's like therapy on its own. Just trying to help other people, talking to other people, and just listening to their issues, and just not give them advice or preach to them, but just maneuver and talk to them, and
listen to them.
And listening, that is the best therapy, actually. That is the best therapy.
So now you go maybe twice a year just to check in. Before, how frequent would you balance your medication with talk therapy?
Well, as you know, in Zimbabwe, there are only 17 registered psychiatrists. You get what I mean? The whole country with 16 million people. So I think he also tried to make me go at least once a month.
Okay, which is still good.
Yes,
which
that
is
was still
really
good.
Yeah. Okay, but now I think also because now now I've been diagnosed, now I know what's the matter, now I know how to deal with it, now I can live my life, right? And then you decide, if I felt like this and I didn't know, imagine how many other people feel like this and they don't know. Then what do you do?
Oh, that's when I formed a support group. I started a support group that actually just to raise awareness and to give support to people with OCD. And it's amazing the number of people that have come forward I've got quite a good following, and more are still coming. And again, I still have that, I can't quite reach out to everyone because some people still refuse to listen or to understand or refuse to acknowledge the fact that this is something mental and not something spiritual. So I always, if it's a public hearing or sorry, a public address, or it's on Facebook or whatever, I always find a few people who come to my inbox and then tell me their issues. Then at least that way, no one, I'm not really affecting anyone else. Those ones with their own thoughts and so on. If I try to explain, if they don't listen, well, whatever. But at least I'm managing to help other people. We've found a support group. We've got a lot of people in there. We've got people who are suffering from all sorts of OCD, wouldn't even know that, you know, exactly. They could, we've got people who suffer from what we call homosexual OCD, where they've got the fear of being gay, or we've got people who suffer from harm OCD, the fear of hurting their young ones or their relatives. We've got relationship. Oh, that one is also a big one. People suffering from relationship OCD. And you'll be amazed, or religious OCD. You know, you'll be amazed at the number of people who have come forward, and some have actually literally just cried, just knowing that this is a disorder. People actually, yes, and then they're not alone. It's amazing. It's really amazing. So just the fact that I'm able to help other people, outreach, and, you know, just talk to people, it's wonderful. It's wonderful.
Cultural, religious differences, witchcraft. How do we deal with this in Africa? How do we deal with let's say, because for now we're talking OCD. How do you explain to somebody that you have not been bewitched? Because, like I always say, what is the diagnosis for witchcraft? You know, how do you know? Like, the person has to meet 1, 2, and 3 to know that this is witchcraft. How do you diagnose it? Me, I'm not trying to dispute it and say it's not there, but I don't know. You know, how do you then explain to somebody that who says, I've been bewitched, my family or my aunt or my neighbors, they don't like me, and this is what they're doing to me? How do you explain to them that no?
You have to take it one day at a time. One day at a time. Usually what I do is I start by telling my story. Because most people, if you start asking them about, why do you think you were bewitched, blah, 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 they're not going to listen to whatever you have to say. They won't listen. So I usually tell my story. I usually tell my story and go into witchcraft, go into demons, go into whatever, just telling them that that's what I thought I had. You get what I mean? And the moment you start talking about that, they actually start to listen to you. Yes. So maybe she could be right. Maybe she's right. And I stop talking about how our brain lies to us, how our brain, you know, they mistreat, they give us a what do you call it? Fraud news. What do you call it? What does Trump say? Fake news. Trump says they give us fake news. So you need to make them understand that, you know, and once they understand, they start listening. And once they start listening, then we go through all the motions. Exactly, what is it exactly that you feel? And then, you know, we look at it one by one and eliminating the different, you know, symptoms, so that at least they're able to assimilate what you're trying to say and to understand. And amazing how so many of them say, oh my God, where have you been all these years? Where have you been? And, you know, it does help. Peer-to-peer support helps.
Now, Zimbabwe OCD Trust. What do you guys do? Miss, you are the founder and CEO. What is Zimbabwe OCD Trust all about?
Well, what we do is we basically raise awareness. We are trying to tell people that there is a disorder called obsessive compulsive disorder. We're trying to get people to come forward and to seek help. When I say seek help, it's like if we talk and then you encourage them to say, I mean, let them talk about their issues and so on. And once they've done that, then depending on how bad it is, we then tell the people to seek help, refer them to a psychiatrist so that at least they can get help. So we're trying to raise awareness. And of course, it's not just about OCD, because OCD can cause depression, anxiety. You can start taking drugs and alcohol because you want the thoughts to go away. So it also involves drug and alcohol abuse and suicidal thoughts, because once you feel you can't solve this problem, you want to end your life. So it's all about those things. So we give each other support. But what we've also noticed is that it's not just about talking. We can't just talk. We need to do more than just talking. We need to do more than just supporting each other verbally. So we're actually trying to set up a center, a care farm, where people can come for weekends, have just relax in an environment, a safe place where people can sit, relax, and talk about their problems, or those who need more time, healing time, a place where they can go and just, relax for a few weeks and so on. And they'll also be getting life skills and things like that. So that is what we're trying to do.
Which is really amazing because, like you said, in a country of 16 million people, having about 17 psychiatrists is not enough to deal with the issues that the country is facing, you know, in terms of mental health. That's why we really, really have to employ other methods. We really have to find other ways that we can do this. So how do people reach you? How can people contact you? Now, I sitting thinking, somebody listening to this and they're in Zimbabwe and they're thinking, actually, I've been having thoughts like this, or I have these kinds of, obsessions. Now, how can I reach you?
They can find us on our website, www. .zimbabweocdtrust.org, or they can find us on Twitter, on Facebook, Instagram, you name it, or just Google OCD, Zimbabwe OCD Trusts. I mean, right now we've got so many articles now on Google on Zimbabwe OCD Trust, and they can get in touch with me. And we'll take it up from there. But really, there is help out there. And being as well a member of the Global Mental Health Peer Network, I'm actually the deputy representative for Africa. So we're actually going to do a major campaign on stigma and mental health in Africa. And we're going to try and look at all these cultural things that actually prevent people from seeking help. So I'm hoping that the impact will not be just for Zimbabwe, but for the whole of Africa, especially the Black Africans.
Yes, 100%, because we're the ones who are just like, hey, these are not our problems. These are their problems. And this is not true.
And as well, I like this idea of involving people with lived experience.
Yes.
Because if, during this COVID time, there were all sorts of groups that came up on mental health because everyone is talking mental health. But it's like when they're talking about mental health, they're talking about us as people who are okay, but might be affected because of this COVID, and them, people with mental health conditions. So we need to make sure that us, the people with mental health conditions, are actually in the forefront of telling people that, no, this is how it is, you can get help. Because I think psychiatrists, psychologists, and so on. What their job is to give people medication.
Yes.
And, oh, you say you've got this issue. If we give you medication, then you'll be okay. And because they're so overwhelmed, they don't have time to really
Yes.
sit down with anyone.
Yes.
So if we come forward and say, people, let's find ways of helping each other. Let's find ways of helping all these people, because it's amazing the number of people out there with problems, and maybe not them, but their relatives.
Yes.
Their children, their husbands, so we need to come forward and see how we can help each other, help people with the conditions, help their carers as well.
Exactly. It's very important also because we have to also take away this division of us and them when it comes to mental conditions, because it can affect all of us at the end of the day. It's all us, if you can think, if you have a brain, if you have blood in your veins, if you're capable of getting flu, you're capable of getting depression.
Oh yes. Oh yes.
And
that's what people don't realize until it affects them. When they're hit.
This is what we should stop waiting for. Don't wait till it happens to you. Don't wait till it happens to your relative, somebody close to you, for you to be like, yeah. It's like this corona when it started. Everyone was like, corona, no, it doesn't stick on black people. It's just for Asians. It's just for this and this. This was the narrative in the beginning. And then see a famous black person who has corona and you're like, maybe it's for Americans. Until it happens to somebody in your neighborhood. And then you're like, actually, there really is corona. Same thing with mental illness. We should not wait for it to happen to me, to somebody, for me to then raise my head and be like, oh, actually, there's something like this. We should really stay knowing right now so that we can spot the signs. Imagine how long you had to wait for you to actually these were signs of OCD. But if you had this information from as early as high school, when the symptoms started, you would have known how to deal with it from that time.
That's the other thing that we are trying to talk to our ministry to say, that I think they should introduce mental health lessons in school, even if it's just 30 minutes.
School, and as early as primary school, because if 5-year-olds are committing suicide because of depression,
that is so sad.
It's too much, you know what I mean?
That is so sad.
When I come up with these statistics and I tell people 5-year-olds, the youngest person in South Africa to commit suicide was 6 years old, then people will say, yeah, when we go South Africa, they have problems like that. What are you talking about? What are you talking about? There's always this them thing. You know what I mean? When we talk about, oh, this is happening, but people in the US, they are like that. No, this is not a people in the US problem. This is not people in South Africa problem. This is our problem.
Our problem. That's very true. It's like with OCD, people started saying, no, it's a white man's disorder.
Yes.
Or you are, you want to act as if you're white.
Yes, exactly.
Things like that. Those are really, it doesn't discriminate. It does not discriminate. And it says that 1.4% of any population, regardless of race, of color, of, age, it can affect you.
Yeah.
That's what people don't know. And people refuse to know.
How did you deal with it when people came up to you and they were saying, Angelica, man, this is, you have to be strong. These things don't happen to us. These are white people beings. So how did you deal with that?
It was a very difficult time. It was a difficult time. And even to the extent that some people said, no, don't talk about it. Said, what will people say? If you come out and talk about it, people just look at you in a weird way and blah, blah, blah. And I said to myself, no. Then I also realized the more I talked about it, the freer I became.
Yes.
My confidence came back, my self-esteem came back by talking about it.
Yes.
you know, so I refused to be intimidated.
Yeah.
I refused to stay in the closet because that's what I'd been doing all these years,
Yes.
not talking about it,
Exactly.
you know? Yeah.
Hmm,
So it was, at first it was very difficult, but now it's nothing. People say, oh, you're so brave, you're so what? I said, no, if I don't speak out, what difference have I made in this world? What is my purpose in this world? All along, I couldn't speak because I had this thing.
Yes.
Now that I know better, I might as well use my suffering for the good of others.
Yes.
And that's what I said. That's what I'm doing right now.
Exactly. I mean, it's
Yeah.
true. I mean, because if you don't talk about it, then it's gonna happen to me, and I won't know, and I won't talk about it, and I will also be in the closet, and it's gonna keep going, and people are gonna die of things because they don't know.
We need to, yes. So it was like, it stops here.
Yeah.
It stops with me. I'm not going to keep quiet. I'm going to talk. My family members, most of them are not coming out, but I talk about it every chance I get, family gatherings, and whatever little messages I sent to other people, I also send them, so that even if they don't want to talk about it, but at least they can start thinking about it to
And
say.
they exactly. It's like a good song. You don't know when it will hit you, right? You
Oh
keep
yeah.
the radio until one time you find yourself singing that song, and you're like,
Over and
that
over.
song, right? Exactly.
Yeah,
And it's so
yeah.
important. How for you, how would you say, how important is it to have family support, to have your family know what you're struggling with and support you? Did you have that maybe from anyone close to you, like maybe your husband or your kids or, colleagues? How important is it?
I think my husband at first didn't understand.
Mm,
It took him time to understand exactly what I was going through.
mm,
And my daughter, I think she understood,
mm.
and she supports me. And family members, especially those on my mother's side, they understood. They understood because it also affected
Them.
them somehow, and they knew what I was talking about.
Yeah.
You get what I mean?
Yeah.
So on my mother's side, I think they sort of understood, and they're supporting me, although some still are not coming out. Although I can tell, you can tell that this person is OCD, because I know all the symptoms, but they don't want to come out. So I just, I always tell them, please, whenever you're ready, come
Yes.
forward, because as in the family, we've had people who were accused of witchcraft. They say this one, the husband is always looking, he's always sleeping, he's always looking down, he doesn't say anything, no, because he was bewitched. And people have got that in their mind. Yes, that
Yes.
person was bewitched.
And it
And
just makes
so
sense.
it's sad. It's sad how this thing can actually ruin families.
Yes. Yes.
Some are bewitched, some are told, oh, when this one died, I remember a cousin of mine died, and when she passed on, when they went into a room, they found all sorts of little bottles with the medicine, so with not medicine, herbs. And the moment the people start seeing herbs, they're already saying, no, she was taken to this witch doctor, and he gave it. But in the end, I said to myself, no, this person was actually trying to survive.
Yeah.
This person was confused. She didn't know what was going on with her. And so she actually tried to to look for help in any other way. Because again, I'm sure she went to church and she didn't get what she
Exactly. I'm sure
wanted.
she tried so many other things. Hmm.
Yeah.
Wow, Angelica, thank you so much. This has been really good. For you, what do you think is the most important thing for people to know about OCD? Like, what is a message that you would like to leave people with, to say, there's this OCD, how do you deal with it? What is like a message that is in your heart that you really feel the need to share with people?
I think the first thing is to acknowledge that you do have a problem. Once you have acknowledged, then you need to seek help. And whatever thoughts that are coming into one's mind, don't take them for granted. Don't think they will just go away, because or try to force them to go away, because the more you force them, the stronger they'll be. So acknowledge that you have a problem, talk to someone, seek help, and life goes on.
Life surely does.
And try to get proper help, not help from pastors who drive out demons, not help from. I'm sure if you've tried all those things and nothing worked, then go to a psychiatrist.
Yeah.
Go to a psychiatrist. Yeah.
And what about people from like maybe an older school of thought? Because, you know, I think this message can resonate with younger people. I'm at 2000 and these upcoming young people, they might understand, you know, maybe the youth might understand. But now, what do you say to the older people, like my parents, my grandparents? How do I explain to my grandparents, like, Lalela OCD, what message do you have to them? Because these are the people who's then still, you know, come with witchcraft, come with say, no, you need to try this, herbs and whatnot. How do we get the message across to the older generation?
It's not easy. It's not easy, because some even think because they hear voices, they've got superpowers. Yes, some I think that because they can dream, because some of the things are actually in dreams and so on. So some don't even want to get rid of it. But it's very difficult. You just need to talk to them a bit by bit, take it one day at a time, to explain to them that no, what they're actually suffering from is a disorder. But again, it might be a generation gone. It might be a generation gone with all its sufferings and so on. But if and some of these people, especially the elderly, they no longer have, they don't have access to internet. They don't have access to some of these years. So it's very difficult to be able to reach everyone. But what I always do is whoever I can reach. And if I can get hold of the parent of their children, then I say, no, you know, these things happen, you need to seek help and so on. You'll be amazed at even a number of people who don't want to come forward when their mothers have got schizophrenia, or when they develop even dementia and so on. Some of us start saying, no, we don't have such things in our families. So if you say I should go and see a psychiatrist, you want to say that, you know, we are mad people in our families. So it's a difficult one to crack. But I'm hoping that, you know, if we can reach as many people as we can, people will get help. People will come forward.
If you help one person, they will go and help another person.
Very true.
Yeah.
Very true.
So now me and you are saying that mental health should be taught in schools. Now, how do you teach a 5-year-old? I have a 5-year-old son. How do I tell him about OCD in 5-year-old terms?
Well, you don't really have to talk about OCD as such, but you can just start talking about physical health. Talk about physical health and talk about mental health. I think that should help. You tell them that, you know, our heart pumps blood into our system, and if our heart stops pumping, that means our whole body gets sick. Yes, or if part of that heart is not working properly, something will be affected. Our lungs, they breathe air into, we distribute air into our systems, or our kidneys, it cleans our system with impurities. Our brain, then you can also go to the brain. Our brain also sends information to different parts of our bodies, so that our brain can understand what's going on. So if any of these systems malfunction, we get affected. Don't concentrate on the mental health. Concentrate on the general well-being of the person.
I think the same way that we teach them about the physical, we should try to also implement the same about mental. The same way they sing about heads, shoulders, knees, and toes.
Oh, yes.
We should have something similar to that when it comes to, you know, their mental health.
Yeah.
Oh, wow. This has been really nice. Thank you so much once again for your time, for sharing your story. It's totally relatable. I am sure that a lot of people who will be listening to this will be able to identify also within themselves. They'll be able to know some of the signs and the symptoms to look out for. I think it's also very important that to know that OCD is really not just about somebody just overly cleaning or trying to be over hygienic and all of that. It's way deeper than that. It's way more than that. And it's manageable.
It's manageable. That's the biggest thing that people need to know. It is manageable. You don't have to suffer the rest of your life from these OCD symptoms. You get help, talk about it, and you're good to go.
Yes.
You're good to go. You can lead a normal life.
Exactly.
Yes.
Right. So this is me, Yvette. Thank you to everybody for watching this. I hope it's been really helpful. Thank you to you once again, Angelica. I'm going to include in the description box where people can contact you on Facebook, Instagram, all of your socials, as well as the website. So if anyone is in Zimbabwe, and not just about OCD, I mean anything that is related to mental health, I'm sure they can reach out to you, and you'll be able to guide them as to where they can go, where they can find help, and things like that, right?
Right. No, thank you so much, Yvette. It was a pleasure. We meet again.
Definitely.
Yeah.
All right. Thank you so much, Angelica. I really, really appreciate this.
My pleasure, Yvette. And thank you for having me.